would you answer? It's 2 o'clock in the morning, you're fast asleep. If you have a family and loved ones, they're tucked away too. And all of a sudden, you smell smoke, you smell fire. And you get up, and you take a look outside, and you realize your kitchen is engulfed in fire, and it's spreading quickly into your living area. What do? You get up, you get your loved ones, you move them to safety. Who do you call? Who do you call? Fire service or Ghostbusters? Fire service, I hope. What about if you're at dinner with friends, enjoying a great time, and all of a sudden, one of your friends grabs their chest and drops to the ground? What do? Who do you call? An ambulance, someone to help them. Now what happens if in the moment that you have called that first responder to extinguish the fire to your home or to save your friend, when they arrive, they are not properly equipped to save your home or your friend? The fire service doesn't have the right hose to connect, or the hose is too small, or it doesn't reach into your home. And the ambulance service doesn't have a properly working defibrillator. Now, how do you feel? You're frustrated, you're scared, you're angry, all kinds of emotions are going through your mind, right? But imagine what's going through the mind of those first responders who have been trained to do a specific job, but because of the lack of equipment and support, they cannot get it done effectively. When we think about the pandemic and what's happened over the last 2 to 3 years, which feels like forever right now for most of us, many first responders have experienced some serious trauma for holding space, for being able to do their jobs ineffectively, either because of lack of equipment to save lives, or because of the mental anguish that they experience because of the loss of so many lives. Today, I want to talk to you about some very special first responders, some hidden first responders that we did not remember during this pandemic. Your HR teams in your organization. I want to take you back to April 3rd, 2020. I don't know if you remember this day. Where were you on this day when we were asked to stand outside and clap and cheer for the hard work that our first responders were doing throughout this pandemic? I was on my veranda in Barbados, beautiful sunny day, with my neighbors, everyone outside with pots, pans, clapping and cheering for the first responders. But in the back of my mind, I could not help but think for one moment, wouldn't it have been great if not only we were clapping for the medical first responders, but for the HR teams who also have struggled through this pandemic? You see, in HR, we spent a lot of time at the start of this pandemic and continuing to this day, sitting glued to our televisions, trying to figure out when governments changed legislation, how that was going to impact company policy, who we were going to have to send home, how were we going to get employees to stay at home and work in a safe environment, how are we going to deal with the new changes in company culture dynamics? Because now not only were we dealing with working remotely, but we also had a different kind of culture. Our home culture and our company cultures all of a sudden merged. We were dealing with our children, parents if they lived with us, other loved ones if they lived with us, but we were still holding space, not just professionally, but emotionally for our employees. The distress that people felt from working at home alone. The distress that people felt from getting to know spouses who they only passed as ships in the night when they got up for breakfast in the morning and were bye and everyone was gone to the office, or when they got their kids ready and they took them off to school and then you took them to activities, and that was life before the pandemic. But now all of a sudden you're all stuck in one space and you realize you either can't stand each other, you don't know each other, you now have to get to know each other. And a lot of times as HR, we were dealing with the same things, but we were taking our time to hold space for you, for employees. Our new dynamic, engaging employees remotely. That was the new brain teaser for a lot of us. How do we do that? How do we get all the technologies working so that people can work safely? And our new catchphrase became, I can't hear you, you're on mute. What are you saying? We heard a lot of that during meetings, right? Every time you turn around, someone's talking to you, but they're on mute. And it felt like that for a lot of us in the HR space. Burnout became very real for us, but vocalizing that burnout was hard. Because how do you tell your CEO, who is looking to you to support the organization, that you need support too? And this is where my story begins. I've been in the HR profession for over 16 years. And in those 16 years, not only have I been the stalwart professional, always finding solutions, running into burning buildings like a superhero, but I also was that person who was holding emotional space for people. And I will be the first to tell you, when you are holding emotional space for people in an organization of hundreds or thousands, it's hard to be a department of one. Listening to so many stories, hearing so many challenges, disciplining employees, dealing with people leaving their jobs, losing their lives. My first bout of burnout happened as a result of losing an employee to suicide. The first time ever in my life, I lost an employee, and it rocked my brain. It shattered my world. And I didn't feel like I was the professional that I should be. I didn't feel that I was doing my best. I felt that I failed that person. My second bout of burnout, through this pandemic. There were so many days in trying to convince leadership why everyone deserved to keep their job, why everyone deserved to be able to continue to work from home was a constant struggle for me. And there were moments where I was completely exhausted. The hardest part through this pandemic was actually losing my job. When decisions are made that everyone else has value, but the people who support the people, causes great mental anguish and distress. And I got to a point where I felt that I couldn't go on. Had not for the love of my mom and my children at that time to will me back, and sitting by my bed for weeks on end, just asking me, begging me to do something, move, say something, anything, I couldn't. I made a conscious choice in that moment that I would go to get help. And I went to therapy. I learned a lot about myself in therapy. And I learned that I couldn't do this thing called HR on my own anymore. And so I made a conscious decision to get a coach, to figure out what I was going to do about this career that I loved so much, that I gave so much to, but it just wasn't doing the same for me. And it was on this journey that I started to think about, I couldn't be the only one that was going through this. I couldn't be the only HR professional that was suffering this way, that was feeling this mental anguish, this anxiety, this distress, this trauma. I couldn't be alone. And so I did what most people do. I took to Google because I figured, hey, if I go on Google, I'll probably find something that's going to help me and tell me how other HR professionals are doing mentally, right? Wrong. What I found was what HR can do to support employees during mental trauma through the pandemic. What HR can do to support the business when they're going through this pandemic. But I couldn't find anything that said how HR professionals were actually doing. So I said, okay, I need to find the answer because I need to know I'm not alone. And so I did the next thing. I took to my first favorite place on planet Earth right now, which is LinkedIn. And I went to LinkedIn and I said, I'm going to ask my HR community on LinkedIn, what's going on? How are they feeling? How are they coping through this pandemic? And in doing that, I realized there are over 4 million HR professionals on LinkedIn, active globally. So I said, I'm going to do a couple things. I started sharing my story. People started sharing theirs. And slowly but surely, I realized I was not alone. So then I decided, I'm going to open up my heart, my home, my Zoom to my fellow HR professionals. And I started having virtual coffees with them. Slowly but surely, I started to hear the stories of being a department of one, taking care of 400 employees, 500 employees, 700 employees, getting no actual support from leaderships in their organizations. No tech, just Google Sheets and Excel. That's how we're supposed to manage. But we're supposed to be strategic. But we're supposed to hold space. How do we do that? It's impossible. So then I decided I would create a couple polls on LinkedIn just to see how people were really feeling and what they were doing. And then I got a bigger picture. So the first question I asked my HR community on LinkedIn was, what are some of the challenges that you're having through this pandemic right now that is impacting your mental health? Are you struggling with insomnia? Because I was. Were you struggling with anxiety, stress, depression? What is your biggest challenge right now as HR professionals? And 38% said they were struggling with anxiety, followed by stress, 42%. Now, in this particular instance, over 700 people responded to this poll. So then I put another poll out there and I asked, so tell me, are you an HR professional in a department of one, taking care of 1 to 500 employees? What's the ratio? Now there's no exact science to this, but there's something that tells us there's a point in time when too much is too much. So how many people are you facilitating at this point? Over 300 people responded to this poll and said that they were a department of either 1 or 2 people supporting up to 500 people. And they were struggling. It was hard. And my last poll, I asked the question, so tell me, how do you get support? How do you get help? Are you a cheerleader of one? Do you get help from your team? Are you getting help from your network, meaning fellow HR professionals in a network? Are you using a mentor or a coach? How are you getting support? Over 1,000 people responded to this poll. And 33% said they are a cheerleader of one. And that was the story I heard from thousands of HR professionals who had virtual coffees with me over the last 2.5 years throughout this pandemic. I am here today to say to leaders in organizations, think differently about how you take care of your HR teams, about how you view them, how you see them, how you hear them. Because what we really need is not for you to just ask us, are you okay? And then keep it moving. But ask us, are we okay? And hear when we say no, and ask us what we need and give it to us. I truly do believe that HR professionals, just like first responders, when they're dealing with traumatic situations and they're sent to therapy to get help, that therapy should be something that's integral in the HR packages that are offered when people are employed in this position. I truly believe that therapy and coaching hand in hand will help HR professionals to get a better perspective and to be able to get a better understanding of what we're dealing with when it comes to working in an organization, when it comes to holding and sharing space for different individuals, all struggling with different things, but understanding that our hearts need time to heal from whatever traumas we experience in the workplace. We have been dealing with trauma long before the pandemic. We will continue to deal with trauma and stress after this pandemic. But the point is, we can't do it effectively and efficiently if we don't get the help and the support that we need. So leaders need to hear us, and you need to be considerate. When we are taking vacation, you know you don't need us while we're on vacation. Those emails that you keep sending, those phone calls that you make at 8 o'clock or 2 o'clock in the morning and you expect us to answer them, you know you don't need an answer right now. You know it can wait. You know that particular termination or disciplinary issue that you're dealing with does not have to happen immediately. Think about the people who are going to roll out or execute those things on your behalf. Think about our feelings. Think about how it's going to impact us. And then communicate effectively. But not only do I want to put out that to organizations and leaders in organizations, but I also want to give advice to my HR counterparts. And I want to say that a happy, healthy HR professional is a safe HR professional. What do I mean by that? It means that you are self-aware. You're self-aware that you cannot do it all. You are aware of your shortcomings, and you're willing to ask for help, which means that you are going to you're going to act. And you're going to have those courageous conversations with your leaders in your organization to say when you are not okay, when you do need that help, how you need that help. And in the moments that you do not get that support, you're going to be willing to be courageous enough to walk away. A happy, safe HR professional knows how to forgive themselves. Forgive the moments where you were not able to be triumphant. We take those things very personal as HR. When we are not able to get the best outcome, it is something we all struggle with mentally. But be in a position to stand in a mirror and look at yourself and say, I forgive you. It's okay. And last but not least, a safe HR professional knows how to educate themselves. Educate yourself on how you can get the technologies, the resources that you need in people, the knowledge and experience that you need in order to be the best HR professional that you can be. But these things take time and commitment and energy from you. I want to close off by using the words of one of my favorite people, Dwayne "The Rock" Johnson, who said that he had a huge respect for first responders because they are the unsung heroes who are willing to run into danger when everyone else is running away from it. Your HR teams are the unsung first responders in your organization. They will always run into that crisis, into whatever danger, and they will help you deal with it. But you need to be able to recognize that HR people are people too, needing help, needing support, needing compassion, needing empathy, because without that, we cannot do our jobs effectively. So please, think differently. Think more creatively when it comes to how you support your HR teams. And they will be the best first responders you could ever ask for. Thank you.